from Elmore County. I will chair today's meeting and represent Elmore County. I call the Public Health District Board Budget Committee meeting to order Friday, May 8th at 10:15 a.m. to consider the proposed fiscal year 2027 budget for Central District Health. Roll call by counties. This budget committee consists of the chair of or designee of each county commissioner within the District 4, including Boise, 80, Elmore, and Valley counties. Each county will cast only one vote, starting with Valley County, then Ada County, then Elmore County, and then Boise County. Members of the committee, please identify yourselves by stating your name and county for the record.
Commissioner Catlin Caldwell, Valley County.
Commissioner Rob Beck, Ada County.
Commissioner Crystal Rogers, Elmore County. And we are missing Clay Tucker from Boise County. If there are no changes to the agenda, I entertain a motion.
I'll move to adopt the agenda as presented.
Second.
Is there any discussion on the agenda as presented? With no further discussion, I will call for a voice vote to approve the agenda by county. Please state your name and response.
Caldwell, aye.
Beck, aye.
Rogers, aye. Motion carried. All right, and reviewing the Public Health District 4 budget meeting minutes for May 9th of 2025. I have a motion to approve the minutes as presented.
I would move that we approve the minutes as written.
I'll second motion.
Is there any discussion on the minutes? No discussion. I'll call for a vote on the approval of the May 9th, 2025 minutes as presented by each county.
Caldwell, aye.
Beck, aye.
Rogers, aye. Motion carried. So to get discussion and vote on the proposed budget for fiscal year 2027 for Central District Health. In accordance with Idaho Code 39-423, the Budget Committee will now consider Central District Health's fiscal year 2027 budget, which will begin on July 1st, 2026. The county contribution includes a 3% increase from the fiscal year 2026 budget. The total contribution for the proposed fiscal year 2027 budget is $5,847,500. The total proposed fiscal year 2027 Central District Health budget, including all funding sources, is $60,165,600. The budget has been proposed to each Board of Commissioners within our district. Is there any further discussion? I ask for a motion to approve the proposed budget for 2027 as presented beginning July 1st, 2026.
Sure, I do have some comments. If you go through the budget, you find there's a number of areas, several areas, right, that we see when the counties, our portion that the counties pay all comes from property taxes. And there's a number of several areas that the Central District Health could increase their fees to reduce that. And I've had discussions with Les Duke and others on the board, the chairman included, and didn't you say that there is a suggestion that you might start doing that at this next this meeting now following this budget?
Sure. Commissioner Beck, that's correct. We're going to present fee increases for some of the environmental health fees today that will go into effect on July 1.
And there's one of the bigger ones, by the way, which you don't have any control over, but we should at least try with the legislature, and that's the restaurant inspections. Because if you notice in there, it doesn't even, it doesn't even come from half to paying for itself.
That's right.
And so that means the other half has to be paid out of property taxes. And so, we're gonna be hopefully dealing with the legislature, because that's something that's in code. So you can't change that, but that is something that's in code, and we should be doing all we can to reduce our reliance on property taxes. And this will do that. If you do that with the some of the other fees. And there is also a provision in there. If you look, there's a gigantic portion that is paid for WIC. But that's a contract with health and welfare. And that also would be legislative action to increase those fees, because that's all coming from property taxes. And so when the legislature says we don't assess any taxes, we don't charge any property taxes, we don't collect any property taxes, it's not true. If you look at this budget, a lot of that's property taxes. And a lot of it's because they haven't changed the fees yet. Those two for sure, the restaurant inspections, and they could increase the amount of money we get for WIC. And that would reduce our property taxes.
And we had that discussion last meeting on the second one.
Yeah. So I've said my piece. But I want it on the record that that's what we want to vote, and that's what we want to try for through the next fiscal year.
And how many times have we tried on that food inspections with the legislature?
Almost every year for like 20 years. So
I've
it's,
been on, I know,
yeah.
so I didn't know previous to that. It is an uphill battle.
Yes, it is, because there's groups that represent the restaurants that they want taxpayers to pay for, property taxpayers, as opposed to themselves, which doesn't make sense.
And there's not less restaurants opening.
Well, yeah. And they should be inspected. I think the public, that's one of the things the public expects us to do, expects the district health to do, to make sure that when you go into a restaurant that it's clean and sanitary, you're not gonna get sick. And so we want those restaurant inspections, but it'd be kind of nice if the owners paid a bigger share of it than property taxes.
If it would pay for itself,
Well, that'd be my preference, just to have
the program, yes.
Yeah, that they should just, it's a user fee, should be a flat out user fee. But anyway, so I've said my piece.
Maybe we just more of an education piece, similar along the way.
Right.
Okay. I would entertain a motion.
Madam Chair, I would move to approve the proposed Central District Health fiscal year 2027 budget as presented to begin on July 1, 2027.
Do you need a second?
I do.
I'll second the motion.
Is there any further discussion? No further discussion? I'll call for a roll call by county.
Caldwell, aye.
Back aye.
Rogers, aye. Motion has been approved, and the proposed Central District Health budget for 2027 as presented will begin on July 1st, 2026. This concludes the Central District Health Budget Committee meeting. Adjourned.
Okay, we're officially
All right, good morning. We're going to call this May 8th meeting of Central District Health Board to order. Corey is taking a silent roll call and looks like we have a quorum and we will move on to the agenda without objection. We will approve the agenda with unanimous consent. All right, we'll approve the agenda without objection. Similarly, did everyone have a chance to review the minutes? Without objection, we'll approve last month's minutes by unanimous consent. Hearing none, the minutes are approved. Okay, next on the agenda then is a public comment period. It doesn't look like we have anybody here. For once, twice, all right. Next on the agenda is the review of the financial report. Laurel is coming to you.
Thank you, Mr. Chair. Dustin will get page 1 up on the screen. So this report is through the end of April, which is about 83% of the way through the fiscal year. When I was getting my notes ready for today, I looked at where we were this time last year, and our revenues were coming in at 90% of planned amounts and 77% for expenditures, 77%, which was a huge gap, which left us going into the end of the fiscal year with a much bigger gap in expenditures and revenues than we have this year, which you'll see that closer margin, 81% for our revenues and 78% for our expenditures. And that reflects a couple things, both our budgeting personnel at 97% instead of the 100% that it would cost for everyone's full FTE for the whole year as the board approved last year's budget and again for this year's budget. And we adhered more closely to our spending plan. So it's been our goal to keep the gap between our expenditures and revenues 5% or under. First year since I've been here that we've been at this point in the fiscal year. So just reflects that closer adherence to what we say we're going to do when we put the budget plan together. So I'm happy to see that. For revenues so far, the main area that you can see that we're off is in our other revenue. That's where most of our opioid funds come in. So that just reflects that we've received less opioid funding than we thought we were going to, as the board has talked about many times. It's variable. We don't know when we're going to get it. We're happy when we do. If we are planning to use it during this fiscal year, it goes into those planned expenditures. If we're not, it goes into our restricted funds, which we'll look at on page 3. For our expenditures, personnel and operating, very close to where we want to be. And then both capital and T&B are under our planned amounts, and coming in total for expenditures at about 78% of where we plan to be. So pretty close. And that also reflects the changes that we made at the budget revision. We've been closer in everything since we made those revisions. Looking at page 2, we will see our comparison to the past 2 fiscal years. Our fees for both community environmental health and family and clinic services continue to show increases. Community environmental health, most of our fee categories are fairly level year over year, but we're still seeing about a $65,000 increase compared to last year. That reflects increases in number of food facilities where we're doing inspections and overall increased number of inspections that we're doing, but it's fairly slight when you look at the whole amount that's coming in. Our FCS fee revenue, however, continues to show significant increases compared to the past 2 fiscal years. The comparison to last year is about a 75% increase. Last year, we did have a lag in our reporting of our fee revenue while we were training new staff. So that's why that one shows lower than either FY24 or FY26. But even looking back at FY24, which I think was a true representation of where our fees were, it's still a 60% increase. So that reflects an increase in being able to charge more home visiting visits to Medicaid and closer adherence to our collections policy and attempting to collect when people come in for their appointments. So lots of good improvements there that resulted in a huge increase. think a huge increase in what we're collecting in fees and family and clinic services. Contracts amount, no change there, continue to be down compared to the last couple of fiscal years. And if we'd looked further back into the COVID years, down even more significantly from that. And that reflects continued decreases in contracts that we're receiving, mostly from health and welfare. Revenues, on this page, you see our fee and contract revenue showing about 3.8 and 3.2% under planned amounts. And that is after we increased them both at the budget revision. So still very close to where we want to be, and an increase over the last 2 years. Looking at our expenditures, as we saw on the first page, personnel and operating costs are coming in a little bit under budget, which is good. And then our TMB and capital outlay are more significantly under budget. Capital is pretty close. We're going to talk more about exciting capital move on the next page. And then TMB, that's the money that we're subgranting out to community partners to work for us or with us, and that can vary as well. On to our cash balance statement. We see total cash balances at month end of 11.4 million. And our special projects and carryover designation, the balance remaining there is 1.2 million. The good news I want to share is that we did award a contract for our bathroom remodel. When we had our last board meeting, at that point, I wasn't sure that we were going to get any bids in. We did that Thursday night and Friday during the board meeting. We're actually receiving bids while I was in here saying, I don't know what's going to happen. So we got several bids in, and the winning bid was about $150,000 less than the cheapest bid we had gotten prior to putting it out more widely to bid this year. So that was a really successful practice. Got a variety of costs. All of them met the basic requirements of the construction project, and it includes specifications even for the types of materials used. So the money savings is actual and something that we're going to realize, not just not being unsure of how much things will cost going into the project. So that's really exciting. And in addition to that, they're ready to start almost right away. They'll be able to start the week after next. And they'll be letting us know soon what the plan is in terms of the order that they'll be working through the bathrooms in the building. But by the time you're back here for the next board meeting, hopefully the 2 bathrooms up here will be modernized, ready to go, and working great. So that's the hope. But we'll have at least a finalized timeline, and some of the bathrooms will have been started on, if not finished completely, by the time of the next board meeting. So we're really excited about that. Thank you for the board's continued support of that. That's going to make a big difference here. Let's see, for our IT equipment and support, that still has a big balance. Curtis and I have been talking this week. We are having some updated needs with some of our Excel integrations. So there may be a need for looking at another third-party vendor to help with some of those integrations. If so, it would likely come out of that IT equipment and support special project, but we're not sure about that. The other sizable balance there, if you come to the second to last of the special projects, is the capital improvement continuation of the McCall facility and the Armstrong bathroom. The McCall facility, part of it will be starting not this weekend, the following weekend. And that's just the new countertops, the new flooring in the rooms that didn't get carpet updated, and the trim and things that go along with that. So that's relatively small compared to the first chunk of the remodel that we did there, just finishing everything up. And then the bathroom falls into that category as well. So we'll see that go down. They, for their payment structure, will be charging us incrementally as pieces of the work get done, just using a standard payment model. So I'm not sure if any of those will hit before the end of the fiscal year. And I would expect some of it would, at least before the end of the fiscal year. Okay, and then our personnel reserve for the 27th pay period is fully funded at about $500,000. We won't have a need to increase that. We may have a need to either leave it the same or decrease it. With our slight reduction in FTEs with the board approved budget. We'll have that prepared by the time of the next board meeting. Our operational reserves still reflect a full 3-month operating balance there at almost 4 million. And then of course we have our capital reserve in case of catastrophic capital emergencies at $1 million. That brings our total reserve fund designations to 6.7 million. Our restricted funds are at 3.5 about, and then our remaining balance of undesignated and unrestricted is 1.2 million at 83% of the way through the fiscal year. So a healthy unrestricted undesignated balance.
Very good. Thank you. Any questions? Good. Thank you. Then it's getting passed to Courtney to talk about opioid settlement fund.
Good to see you again. Presentation for you, but I'll wait for that to get pulled up. So today we're going to be talking about opioid settlement funds. Funds to date, we've received $5,034,516.06. As of the completion of our reports in March, we've spent $1,705,859.83, leaving our current balance at $3,328,656.23. So pretty good amount for what we've already received. What we tried to do is expand and diversify our approach in using opioid settlement funds. We recognize that substance use disorder is a continuum, so it requires several different approaches. So that includes upstream prevention. And you've heard from Heather Allen, who's our Youth Alcohol and Substance Use Prevention Program Coordinator, to talk about her role in upstream prevention. We also do secondary prevention, treatment, and recovery. We've got a few special projects to meet the needs of the community. And then certainly leveraging our partnerships to be able to make all of that work happen. In terms of upstream prevention activities, that includes some subgrants to a few different partners, including most predominantly in Boise County. So Youth Dynamics, Horseshoe Bend Schools, Wild Hearts, and Basin School District are all some of the examples of subgrants that we've continued to do. And most of that is going to be doing youth-specific activities, particularly outdoor excursions and other types of prevention activities and educational opportunities. So we've gotten a lot of really positive feedback from that. And this next year, we'll be working on a new opioid settlement reporting paper. We're going to put that together, and it's going to include some pictures from some of those events. So you guys will be able to see that in the future. So it's great to see the kids' smiling faces for some of the activities they've been able to do. Secondary prevention includes our Nurse Family Partnership. Nurse Family Partnership is called out specifically by Johns Hopkins Bloomberg School of Public Health as a best practice for spending opioid settlement funds. So we were quite excited to be able to expand in that this last year. This year, we're going to continue to fund Nurse Family Partnership and also expand that to our Parents as Teachers program as well. So 2 home visiting programs that Central District Health offers. We also fund under secondary prevention our suicide prevention program that is funded in part by the Department of Health and Welfare through a subgrant that we have, but predominantly funded through opioid settlement funds. And that allows us to do training opportunities, educational type of opportunities. This year, we're also expanding into doing hope boxes, which are a best practice in suicide prevention that are a box that provides kind of resources and supports, but also provides folks a means for living. So it's where they can put mementos or documents, pictures of their family, things like that. And then we continue to give out other resources like gun locks and then population-specific resources like the 988 suicide prevention hotline. The drug overdose prevention program is also supported using opioid settlement funds. That is in part supported by a subgrant that we have through the Department of Health and Welfare. But to make up the difference for that, that's where we use opioid settlement funds. And that allows us to do some types of activities like our storefront, which allows us to give out resources to the community. So Sharps containers, Terra drug deactivation pouches, Narcan, CPR rescue masks, those types of resources. And then training and educational opportunities, including events. So this last couple weekends ago, we went up to Idaho City and we did a drug take back day where we got 32.6 pounds of medications from Idaho City. So we were quite excited about that. And that's just one of the examples of partnerships, but also programming that is done under that program. Idaho State University is a secondary prevention activity, but it is also a special project that we've done. So that has been including education to physicians and those that work in the healthcare field, in addition to students. That is on hepatitis and HIV testing and prevention, screening and education. And then also on medication for opioid use disorder for physicians, so how they can implement that as a practice in their clinic. And then treatment and recovery. We have our community health EMS program. So that was funded initially for Elmore County using opioid settlement funds. We used some district funds last year, thanks to your guys' approval for that, to be able to expand that into providing technical assistance and training and outreach to other communities. And then now this next fiscal year, that's going to be predominantly funded using opioid settlement funds again to Elmore County and Boise County, and then working on some initiatives in Ada County as well. So we're quite excited about that reach. That also includes our MOUD clinic services. So under our clinic services division, that allows us to be able to compensate or offset the cost of our medical appointments for clients that are coming in that are underinsured or would receive funds or may not have the cost of their appointments covered based on their insurance, to cover the cost of those appointments. And then counseling available for eligible clients as well. So that can work through secondary trauma for first responders. That can also be for family members and friends that have been impacted by the opioid epidemic. Genesis Community Health is another special project that we do. They have a medical clinic coordinator that we've partnered with them on. So that allows us to be able to do referrals to clients out into the community regarding treatment and service options, and connecting them with support and care. Trivium Life Services did change their name, so they are now under Thrive, but we put that as two sections because we'll have two separate subgrants this last year. Trivium Life Services also does naloxone distribution boxes and then allows us to have personnel and operating for peer recovery specialists to go out into the community and do outreach in addition to their program manager, and then be able to provide supplies. So that is predominantly what's going to happen through Trivium and then now on to Thrive. And Thrive, this emphasis for this last subgrant is to try to get more folks connected into treatment services and to be able to let them know what resources and supports are available. And then in addition to that, providing tools and resources to meet basic needs. So that might include wound care kit supplies, things like that. So that is for our treatment and recovery section. Our special projects include our 5-year strategic plan. We put a 5-year strategic plan together, and where we're at in year 1 is going to be focusing on identifying our funding priorities, looking at what is coming ahead. A lot of that strategic plan was developed based on the opioid environmental scan that we conducted last year in partnership with Boise State University, the Idaho Public Health Institute. And that kind of has given us the guidance as to what our community is looking for regarding opioid settlement funds and how to spend those. And then also some of the feedback that we received from some key informants in the community. So commissioners and other folks that are working in this field. So that is kind of what we've been doing for our 5-year strategic plan. And here we are in year 1, and we're going to be closing that out and possibly providing some revisions here in year 2. Sharps disposal is another kind of interesting development that we've done. So when syringe service programs were repealed, we heard from the community that people didn't know where to drop off their sharps. So that was also something that came up before that time. People didn't know how to dispose of sharps safely, either in residential trash, or if they were in a commercial type of organization providing healthcare services, not knowing what types of contracts they could go out to do biohazardous waste disposal. So we've kind of stepped up and filled the gap for that to do sharps disposal. So we've installed a sharps disposal container out front here at Central District Health Clinic, in addition to Mountain Home Clinic. We've got one in partnership with the Boise Parks and Rec at Van Morrison Park. And then this next year, we're going to expand that to Veterans Park as well. And then we've got one down at the Boise Fire number 5 station, right across the street from Rhodes Skate Park, which was an area of identified syringe litter from our syringe litter environmental scan that we conducted with the public. So that has been really successful. For the Boise location, I service that anywhere from 6 to 8 weeks, and it's an 18-gallon Sharps container, and it's full every time. So it's been a really great need. And then continue to do outreach to the community. So when folks order a Sharps container from the storefront, they get more information about where they can dispose of those Sharps safely. So I anticipate we're going to continue to see that go up as well in terms of utilization. We also came into a recent acquirement of a vending machine. We have had the transfership ownership agreement from the Department of Health and Welfare for the last year, but we had a sub-grantee that we were partnering with to try to get that vending machine up and operational. Ultimately, we decided to pull that and bring it into our clinic just because we felt like it was going to be able to get up and operational more quickly, and then would be of service to our patients that we have that come into the office as well as other community members. So that vending machine will be a free vending machine. So folks can go in, type in a number, and they can get Narcan, they can get a drug deactivation pouch or SARC container. They are also going to be able to get supplies from the clinic. So free screening and testing kits, such as like condoms and lube and other things that are provided through our pharmacy, those types of dental supplies, things like that. So we're quite excited about that. And we're working on a wrap for that machine. So it's going to be CDH branded, and folks will know that it's free resources and supplies. So they don't think that it's like something that they can get candy at, and be able to give out free tools as well. So we're quite excited about that process. We also have naloxone distribution boxes. We have those at strategic locations in all 4 counties. This next year, we're going to be purchasing naloxone distribution boxes specifically for St. Alphonsus. They have 3 locations that they would like us to get those boxes in at. And then we're also working in partnership with the community partner as well to see if they are interested in expanding that. And that would be to support the thrift stores that they service. So those are a couple different things. But right now we've got over 20 naloxone distribution boxes in all 4 counties. The Trauma Intervention Program of Treasure Valley is a special project that we did this last year. We've coordinated with them because they work alongside Ada County Coroner's Office to be able to provide resources and on-site support to individuals that have lost a loved one. So that includes people who have a family member or friend that has passed away from an overdose. And our goal is to work with them to connect with those families, to let them know about our overdose fatality review, to see if they would let us conduct an interview with them to get a form of a timeline regarding that person's life, to see what interventions might have made a difference in changing the trajectory of that person's life. So it's a good practice that is done nationwide through other locations by partnering with our public health and safety team to develop an overdose fatality review. And then in combinations with interviews and medical records, then that would give us an opportunity to figure out what maybe intervention points might have made a difference to preventing that person's death. So that's a project that we're working on this next year. Another special project is our Neighbors Carry Narcan campaign, which has been quite successful and really resonated with the community. That initially was funded in part by other funding streams and some part using opioid settlement funds, but this next year that project will carry on using opioid settlement funds exclusively. For example, we launched that campaign and we had over 70 orders from the storefront in 2 days. So that was a lot, which was incredible because we're reaching people through Meta using Instagram or Facebook and other avenues in a way that we haven't been able to reach people before. And for somebody who's been with Central District Health for going on 5+ years now, our Facebook page has never really been active per se. We've always gotten like a few likes on posts and things, but we got over 46 likes and several reshares regarding that campaign. So that was pretty good for us. And certainly seeing the spike on the storefront was enough of a validation that people were seeing that and increasing traffic to Central District Health's website and increasing traffic to the storefront to be able to get those resources out. So we were quite thrilled with that.
Mr. Chair, can I ask a question? I actually had a community member that received a kit from you that had some of this and a mask in it, and they were actively wondering if they could get more.
Yes.
They participate within the food pantries. And it was very successful to handle up there.
Yeah.
So it is the Cascade Pantry. I don't know.
Oh, yeah, we actually partner with them. We have an naloxone distribution box out
Okay.
there. So they are able to order Narcan directly from Idaho Department of Health and Welfare. They'll ship it directly to there, and then everything else they want to put in the box, our program can provide.
Great.
All they have to do is put the instructions in the order that it's for a naloxone distribution box, and that allows them to supersede limits. But I can reach out to Karen.
Yes,
And,
Karen will.
yeah, I'll let her know. that
Okay.
That's what we can do.
Awesome.
Great, happy to hear that. Types of existing partnerships that we have that we've continued to leverage to get feedback in real time on how we're spending our funds and the direction of spending those funds in the future have been through key partners like the B4 Consortium, the Elmore County Health Coalition, Boise County Health Coalition, Heather's work in Communities for Youth, and then in addition to that, our Public Health and Safety Team, which is a component of the drug overdose prevention program here at Central District Health. And that is it for me.
Yes, Mr. Chair and Courtney, thank you so much. It's encouraging. Do you have any rough numbers of the patients that we have actually enrolled? And do you have any comments on recidivism?
In terms of which sub-grant?
I guess in
Maybe
totality, the whole program, do you have anything there that?
Our program specifically doesn't do, like my program specifically doesn't do referrals. The referrals that would come in would be through nurse family partnerships, and we can get that data to you. The referrals that we also conduct through Genesis, providing that sub-grant through their medical clinic coordinator, I can also get that data to you. I'm terrible at numbers and I invert them in my head, so I'd hate to say what those numbers were.
That would be really interesting.
Yeah, I'd be happy to provide that to you.
Thank you.
Just last night, I saw a post from the Attorney General. And it looks like it says recent settlements in May 2026 is $7.4 billion national settlement with Purdue Pharma and the Sackler family was finalized, resulting in $24 million for Idaho.
Correct.
There, in your calculations, it talks about the distribution, 40% from the state, 40 to local, 20 to health districts, and then gives amounts for 26, 27, and 28 years, the years of 26, 27, 28. In your calculations and planning, is it up to date with this new information or what appears to be new information from the Attorney General's office?
That I received, or the one that I looked at, I thought that was from Idaho News. It didn't say the dispensing that was going to be happening in 2027, 2028, or even in 2026. From what was referenced, they just said that 20% was going to be going to the public health districts. We do have a resource that allows us to be able to look back on what has previously been dispensed. But as Laurel said earlier, those are kind of infrequent and we don't always get the timeline as to when those are going to come through. So we'll continue to manage the sustainability of our funds and look at the growth of our funds where possible. And then as new funds come in, plan to use those in future years so that we have the continuation and sustainability of opioid settlement funds moving forward.
Well, in my quick attempt here with my phone during the meeting, find that article. I couldn't find the article that I saw last night, but I think it gave predicted amounts for those years. So maybe that would, if we could find that and get clarity from what the Attorney General's office is putting out regarding this May announcement, that would help us dial it in a bit on what to plan for. And then one other thing I might point out when we talk about upstream prevention, in the past, it's probably changing now with medical awareness of the dangers of opioid. But at one point, there were about 40% of the opioid addictions were as a result of valid prescriptions at the time that then lead to addictions. And I would point out that in our society, in our healthcare model, we have a lot of policies that restrict or limit access to cheaper, safer, more effective, non-pharmaceutical, non-addictive leading healthcare modalities. And at some point, we should start considering maybe driving the healthcare needs to methods that don't ultimately lead to addiction at such a high percentage also. Now, how much of that we can control here, I don't know, but it should probably be part of the conversation. If there's other things like acupuncture and other things that could serve people's needs that aren't necessarily just right to an opioid for pain management, I think those are things that we should be at least investigating.
Mr. Chair. We provide in our overdose response and overdose prevention trainings information out to the community that follows the CDC's guidelines for alternative modalities regarding pain management. So we do talk about acupuncture. We talk about cognitive behavioral therapy. We talk about breath relaxation techniques, mindfulness, some of the other things that are listed in that as being best practice. So would we encourage folks to take that training when they understand how to administer Narcan? We frame it in the sense of you can prevent a dependence from developing, and the way that you can do that is by having a conversation with your medical provider regarding what alternative pain management strategies are. So that's something that we try to do. And then we've also provided in years past using the drug overdose prevention program, educating providers on the CDC opioid prescribing guidelines and talking about alternative pain management modalities.
Yeah, I've understood that there's a greater emphasis now, and partly because of, Purdue Pharma and this information that came from that company to providers, and the providers get trapped utilizing the information that led to this settlement. Interesting how they're now paying for their misinformation.
Every time I drive by a CVS pharmacy and I see it shut down, I'm like, that's our opioid settlement funds at work.
Anybody else have anything? Thank you.
Thank you.
Quick comment. I just want to, so everything you just saw, Courtney has spearheaded. So we get this money and he has been the lead to develop what you just saw as an incredibly comprehensive plan from kind of addressing an issue that is one of great significance and public health harm, and having a solid footprint in every county and all the different partnerships she's created. I'm just so impressed, and sorry we're getting the money for the reason we are, but glad that we're able to utilize it as intended and to be able to do this work for likely more than a decade into the future, possibly longer. So thank you for your work on this, and just you're really a subject matter expert, and it's great to have you helping lead that for our organization.
Thank you. It's an honor.
Well, thanks again.
Mr. Chair, could we take a quick break?
Sure.
Thank you.
5.
Your question. That'd be great. I became screaming in here. Take care of some things. Yes, thank you.
Okay, welcome back. Next up is Curtis. Natasha, we're going to talk about the district pool plan.
Mr. Chair, thank you. So I'd like to just give a brief overview of kind of what we've done and how we've gotten here. Of course, we're all pretty familiar with the past discussions that we've had, and then I'd like to let Natasha kind of talk about some of the details. So you should have in your packet a handout. You can see with the red text on it. This is our proposal for a recreational water pool plan that we would like to implement. What we've done is we've broken it down in a couple different ways. The first way is we've looked at the number of gallons of water at a facility and broken that down into 3 different distinct options, basically large, medium, and small for facility sizes. And then across the top, you can see that we have 3 different technical assistance program tiers. Each one of those then breaks down into its own unique fee, and I can explain a little bit how we determined that and how we got to that and what we expect from that. Basically, we took our last 5 years of fiscal data on how many hours that we had been putting into the pool programs, how much money it had cost us to operate those pool programs, and we basically developed a per hour cost of about $55 per hour to run our current pool programs as they had been established in the past. Natasha and I spent quite a bit of time going through and developing the different types of technical assistance that would be offered in each type of tier. And then with Natasha's assistance as a subject matter expert, she kind of determined the average amount of time each one of those tasks would take. And then that's how we really developed our fee, when we took that average hourly cost of $55 an hour and put that to the total number of hours that each task would cost in each tier, and came out with some fees that we felt like were justifiable and would cover our cost and keep this cost neutral as we implemented. So that's some background on kind of what we did and how we got to where we're at. I'd like Natasha to share kind of some of the insights on what she has found as she's researched this and some of the differences between some of our tiers and what we anticipate being able to offer to facilities throughout the district.
So Curtis already alluded that you can see that there are 3 levels of facilities that based on the total value per facility. So the way that we determine that, we'll look at all the formerly regulated pools. We'll look at their files and saw that we have our smaller pools anywhere from 10,000 gallons per pool to 25 and up to over 1 million gallons per facility. So, and that would be Roaring Springs, our largest facility, was way over 1 million. So that's how this 3 levels came about. So when we have tier 1, tier 2, and tier 3, with tier 1 being more of a comprehensive technical assistance program with non-regulatory inspections or visits that will be provided 3 times a year, let's say, and on-demand water chemistry testing up to 6 times a year, assessment of the risk management plan. We would be on this. In my head, I'm thinking that this would be an ongoing work that we will be doing with facilities that enroll in the program, is development of the risk management plan. And then we will be providing on-site plan review for any remodel projects or any new construction within the facility. So, so you can see that the fees are definitely vary. So we ended up with 9 different fees depending on the size of the facility and also frequency of our services and the type of services as well. So, and on the second page, you will see additional services. We call them a la carte services that any facility can request, and we will provide everything we can. And we are thinking that we will be reaching out to anywhere from our very large facilities to small pools, gyms or hotels, or even anyone with HOA and the HOA community pool can and pay us to do their water testing or take a sample of their water, take it to the lab for analysis, or provide the consultation of any type. So that's kind of it in the essence.
Mr. Chair and Natasha, down here under number 6 on your certification and training, does that matter if you have 2 people or 6 people in the class? Is it the same cost? Okay, good. Thank you.
As we looked at different agencies, different, I guess, organizations that provide this training, and nationwide, the cost is anywhere from $400 to $390, and we think that $375 per person is pretty doable. And typically, this training is a 2-day training. Thank you.
Also on number 6. So previously, somebody in their organization on municipals had to be CPN certified. Do you think that they're going to still voluntarily do that, or do you think that's going to fine?
We hope so. We hope, because in order to even do basic maintenance of the pool, you will have to have this knowledge.
We used to go to Vegas for it, or somewhere fun. But yeah, it wasn't offered for us. But I hope I hope they continue that, but you can't. There's no regulatory, so.
Mr. Chair, we hope to offer that certified pool operator course similar to the way that we offer our ServSafe certified food managers course. We hold that usually twice a month. People can sign up for it. They pay the fee. It's flat fee for the day's training. This will be operated in a similar way in which we'll advertise for it. We'll get all the people that are interested in doing it. We'll schedule the time to do it. As Natasha stated, it's a 2-day training. They'll pay the fee. We'll provide the training and the education, and they'll be able to take that back to their local facilities and be considered a certified pool operator. So that is our hope and design with that. We do hope it is if we build it, they will come type of thing. Of course, we don't have any type of regulatory authority to require it, but we do feel like we've put together some technical assistance packages that are highly valuable and fairly well priced in terms of what we see with the private market as well. And we hope to be able to market that with the assistance of our communications and marketing team to all the aquatic facilities throughout the district to ensure that they are aware of the service and that we are a valued partner with them in the ongoing safety and operations of their facilities.
It seems like that would be feather in the cap that they want to have.
For sure. And although we won't be permitting or licensing anything, our hope would be that we would be able to offer them some kind of certificate or something like that that acknowledges they've completed the certified pool operators course. That would come with a certificate acknowledgement for them to be able to display to the public that they are a valued partner with Central District Health and that their facilities are clean and operated correctly.
Yes, but Mr. Chair, just one request. Would you keep us updated on the numbers and how well attended this is? Who participates? I think you would be great info.
Yeah, Mr. Chair. For sure, we will update the board, as frequently as necessary to keep you guys updated on where we're at and if we are participating. Thank you for your support with something like this. This has been quite the endeavor to dig into and figure out what we want to do.
So we've already green lighted the concept. It's just a matter of.
Right.
Yep.
Sure. So just I guess more of the history, because I actually worked in state public health when this all happened, was in the year 2000, Central District Health would do inspections and education that came along with that. For the number I have, it's definitely over 200 pools in our health district, and it included like apartment complexes and clubs, like gyms and places like that. The pools were essentially deregulated then unless it was open to the public by general invitation, where you go pay a fee to swim at the pool, not pay a fee to stay at a hotel room and use the pool. Those were removed at that point in time. So, I look at it I don't agree with this. It's not good public health policy in my mind. And we had two options. It's like, okay, now it's completely done. Or this created an opportunity, and thanks to Natasha and Curtis for taking advantage of that, where we could walk away and we're out of the pool business. Or this will allow us, with all the analysis and thought that you put into this, to recapture all those other pools in a non-regulatory way, and it's voluntary. And I'm curious too to see how successful this is, but it's allowing us to, what are they, lemonade out of lemons or whatever. So, it's going to give us an opportunity to really expand our reach again. Probably even prior to the change in the year 2000, to allow us to re-engage with any pool operator that would like our support and technical assistance. So I'm excited about it, and I appreciate, again, it was not a small task to put all this together, and about pool time for the year. So it's good timing on that. Thank you both.
Very good. Any other questions, comments?
Actually, one comment, Mr. Chair. Is it possible to put out who does work with you guys? I don't know. I've become very wary of getting in a pool now after this.
And I before, and I really am now.
Right. I don't know, would it be possible to put out who you're working with so the public would know who's?
We do that through our website, just put a page on there, and who is engaged in our services and receive certificates for the inspections. I love that idea, because it's awareness. We're a state that we believe everybody can make their own choices, including eating sushi made in the kitchen, and they can just choose if it's sold at a farmer's market. You get to make that choice, but I think without the education, you wouldn't know. So that's a great idea.
I do like the certificates when I'm someplace.
Yeah.
Yeah, that are posted.
Thank you. Thank you both. Next, rodents away.
The glad you went on a cruise ship. I know, right?
My brother-in-law is on a cruise ship in Alaska right now.
Oh, is he?
And he's
Okay.
So, Mr. Chair,
Yes.
I'm passing around a document that was not included in your packet, and you should have another document in your packet as well, titled Grants Associated Public Health Concerns in District 4. So those will be the two documents that we look at.
All right. Let's hear it.
Okay. So this is an Ada County specific item, but we wanted to bring awareness to everybody and have an open discussion about what it looks like and what we have been doing and kind of what we're looking for going into the future. So with me today is Dr. Butler Dawson, who will be discussing the health concerns that we would anticipate to see. And then I'd like to start just by going over this handout here. This is something that was developed in coordination with Ada County. Ada County has helped us put this together and provided this information. It kind of outlines the approach that Ada County, the city of Boise, the city of Eagle, Central District Health have collaborated on so far in how we want to proceed with identifying rats as an issue and what we can do about it and how we want to track that. So you can take some time and read through that and look at that. The basic highlights of it is we want to have a very well coordinated effort amongst us as government entities to make sure that we're not overlapping or duplicating services and that we're coordinating our efforts accordingly. We'd like to create some kind of data dashboards where the public can then report sightings to us so that we can actually track those in real time. We can do things like set traps and develop heat maps and things like that to help monitor and manage where we believe rats are currently located. And then really just working on developing our public education and our public communication on the how to best prevent and what some of the common public health concerns may be and things that we can look for to help do that. The one thing that Ada County, City of Boise, City of Eagle, and Central District Health have all pretty much agreed on is that none of us are rodent exterminators in profession. And so while we may not have a direct role in the actual extermination of rodents in private facilities or private buildings, we do see ourselves having a role in the overall education of the public and making sure that they have access to appropriate information, prevention methods, and then have the access to those local exterminators that's necessary to be able to deal with that on their private residence. So with that, I will turn the time over to Jamie, and she will be able to talk about some of the things that we have been able to look for and what we've been doing.
Great, Mr. Chair.
Yes.
So in this document, I have two tables where I'm talking about public health concerns. The first table is the zoonotic disease risk. So the diseases that are associated with rodents, specifically rats for this conversation. Rats are associated with like 34 viruses, very rare viruses and diseases. So not a huge risk right now. In Idaho and in District 4, we haven't seen any rat-associated diseases in the last 2 years due to the influx of rats. So we're monitoring it and conducting surveillance. So I looked at the hospital-based data. So the current surveillance and incident summary here. And there's not an increase in identified hospital-related data looking at rat poisoning, thinking of children who might be exposed to poisoning like rats as people try to kill the rats in terms of wildlife and pets, and then in terms of like diseases. So hospital data hasn't increased with rat-related data. And then reportable diseases, we haven't seen any hantavirus, lepto, the common diseases here like plague. We did have 2 human cases of plague, but that was in 2018 and 2020. And it's endemic in Western US. So with squirrels, rats, other rodents, but all these diseases are rare in District 4 and in Idaho, but the consequences are severe if someone does get it, as we're seeing with the outbreak with the cruise ship. There were 22 Americans on that ship. I don't know, has everyone heard about it in the news? So hantavirus. So hantavirus is a group of several viruses, and the virus that's on the cruise ship is the Andes virus, which is found in South America. And so there is human-to-human transmission, which is not the case for all the other hantaviruses. So that's why this is a huge public health concern right now. But it's not like a COVID-like situation. It's very rare, the transmission still. So you have to be in sustained close contact with each other. Sorry. Like this.
That was unintended.
So we're not concerned, and none of the Americans were from Idaho. But public health professionals were monitoring the cases as well as the potential exposures in the U.S. So moving on to table 2, just thinking about other public health concerns that we don't really think about. We're like, oh, the diseases, especially for our team who's monitoring it. But look at we have the food safety concerns with rats, indoor air quality of allergens. You have asthma, that could be a problem. Rats they like chew on the wiring in houses, so that could be a problem too. And then I talked about the poisoning and then just psychosocial stress. People are calling us, I saw rats, I saw children around rats. So there is that underlying stress that people are feeling and angst with the rats here in the community. And that's it. Any questions about these public health concerns?
Yes, Mr. Chair and Jamie, and thank you, Curtis. Ada County. We got 3 other counties that probably will have rats. So, yeah, you might think about, my good friend who has a business office across from our Mountain Home Post Office went to work. And right in her doorway was a rat. Now, I'm only familiar with a couple species of rats, but this rat was as big as a house cat. So anyway, I just wanted to point out too, this is Ada County specific, and I think it should be District 4 specific. So, thank you.
Well, they're in Canyon County too, right? Or are they not yet?
Oh, I think they're every place. I think they're every place. Yeah. And another comment. How about the homeless population? Those seem like ideal places.
Definitely, yeah. I mean, if they're showing up at the hospital, we're monitoring that, or if they get a reportable disease. But I think there needs to be some coordination with, education. We do go to the Interfaith Homeless Shelter there, so we could talk about education there. Our team's going in a couple of months.
Leave a couple traps.
Yeah. And talking just, covering your food, the basic preventable actions that people could be doing. And then I think also making clinicians aware of the symptoms, because a lot of these symptoms like lepto is like a common flu. Maybe clinicians are not thinking about rat-associated diseases, which could be severe in the long term. Thank you.
So it does seem like we're made aware of Idaho Code 39-420. It talks about health districts' responsibility under this type of thing, and we're maximizing our responsibility to, I think you said, heat maps and tracking, and we're kind of getting into the details of the code and what our responsibility is under that. I'm assuming.
Mr. Chair. Yeah, that's correct. And, any opportunity we have to partner with our fellow government agencies, I think we'll look for those opportunities and work in coordination with them and make sure that we're actively participating in the development of those plans and then executing those plans that we've worked to put together. Part of our public health preparedness team has been very closely involved in working with the county, specifically Ada County, but clearly here other counties may be affected and involved as well, so we can increase that effort as well. But our public health professionals who are professionals in planning are really the ones taking the charge in working with our different county emergency managers, as well as any pest or abatement control, like a mosquito abatement program or anything like that that would be similar to that, and working with them and making sure that we have adequate plans in place to address those.
Very good. All right.
Real quick on. So just want to thank Dr. Butler Dawson she's new to the agency, but she's going to be has been and will be a frequent guest here with the board, often in front of the media that Stephanie and her team helps coordinate, because this communicable and infectious disease is so core to public health. And the extra thing, besides all the various talents that she's brought to the agency, is her ability to analyze data from all these different data sources and hospital data and immunization records and present it in a manner that we can all understand. So I'm just really appreciative to have you here and the work that you've done and been able to share with other health districts, and it's pretty cool.
Thank you. Thank you to be here.
Thank you.
And yeah, I mean, I'm happy to look at hospital related data, what ICD, we could look at the Turkey ICD codes, so just let me know if you have questions or want me to look at your certain county about vaccine rates or anything. I'm happy to help and support the team.
Very good. Anything else? Good. All right. Well, thank you both. Ah, that one's over with.
All right. Story, but I'll save it for.
It's only a matter of time.
As soon as you said where it was at, I knew exactly. The doorway's kind of recessed. She goes in and just sparker.
All right. So Laurel's up next to discuss the new fee schedules. That will take it away.
Thank you, Mr. Chair. I will start with the family and clinic service fees, and Dustin should be pulling those up on the screen, I believe. You have them in your packets if they're not up on the screen. So for FCS, there are no changes to any of the fees compared to last year. Our CDH fee policy dictates that we review the conversion factor in odd calendar years. When we first put the fee policy in place, we didn't have a frequency there. We just said every other, I think we said every other year, but not which year. So last year we updated the policy to say odd calendar years. We looked at it last year. So this year, no changes to the fees. They remain the same for family and clinic services. For environmental health, our fees are, we're proposing that they do increase this year to begin to cover that gap between the total program cost and the fees themselves. And we did this in accordance with the board's recommendation to increase incrementally over a 2 to 3 year period. We'll say as you're reviewing them that another thing Curtis and I will be doing over fiscal year 27 is reviewing the efficiencies that Excella brings to us. So right now we have a fairly significant gap in the cost of the program and the fees themselves. This will get us between a third to a half of the way there. I anticipate that the efficiencies Excella will bring should already close a little bit of that gap so that when we sit here at this meeting next year, it's probably not going to be as much as it looks like now. But we'll be reviewing that over the year. And I believe by midpoint of the fiscal year, by about January timeframe, we should be able to tell you if we're realizing those efficiencies and reduce personnel costs or anything like that, operating costs. So probably by January, we should start to see, we expect the gap going into fiscal year 28 to reduce somewhat on its own, and then additionally in accordance with the fee increases that you see before you right now. Just draw attention to a couple of them. So for the sewage program, individual systems, new, and then new no test hole, we always keep those at exactly half of the fee. So you see 1,070, half of that's 535. So those always stay exactly at half. It's about half the work. So that's consistent through those proposed 2027 fees. And then the other ones are variable increases. On the second page, any of the fees with the asterisk are the ones that are set by law or statute. So those are the ones we have no control over at all. And some of which Commissioner Beck referred to, but those remain unchanged. And just a note on the methodology, Curtis and our program manager for this program spent hours together going over what the actual costs are. In the past, we've used an estimate of like best case scenario, what does a program expert think it takes to perform this service? But they spent time looking at the actual numbers, dividing out the cost, looking at the number of staff doing the work, rather than, well, I think it takes about an hour and a half to do that. So we have a full assessment of how much that gap actually is based on our actual costs. And again, this gets us between a third and a half of the way there.
I just wanted to thank Russ for sending us the septic stuff after the last meeting, so we can't get the numbers. It's good to see, because I assumed, certain things, and it was my assumption.
Shocking, even a fraction. It's just huge.
These are an action item.
So on the clinic fees, a lot of these we are billing to Medicaid correctly. Correct.
We have a combination of Medicaid and self-pay and some privately insured. I don't know that breakdown. Do you know it off the top of your head, Beth?
About 25% that we bill to Medicaid, 50% are self-payer, and then the other 25% are commercial.
So do we know is there a ballpark? I mean, we're billing more than Medicaid allows, right? And then we're bound by the same contractual adjustments any other provider has to take. And then are we a contracted provider for some of those other Possible shield, just like any other
We see all of those.
provider.
What level of service is the home visitation bill at?
The case management code, so it's a flat rate, it's 240.12 is what we get reimbursed for each home visit that we have. It's a, I can't remember, it's a T something.
It's not a Medicaid rate then?
It is a Medicaid rate, yes.
That would reduce a little bit the Medicaid cuts. Used to go over $5. Yeah, it's made a lot of, I mean, that's part of our CSP or fee revenue increase. Been a lot of the revenue coming in and getting that all dialed in over the last year.
All right, any other detailed questions about the fees? So, as Laura pointed out, this is an action item. So do we have a motion regarding adoption?
Chair, I would make a motion to approve the schedule for FY 2027. Second.
There's a motion before us. Is there any discussion on the motion to adopt the fee schedules as presented?
I just want to say a quick thanks to staff for not increasing the pumper truck fee very much. I think that's really important for communities like ours, that we're trying to really promote that you pump your septics every 5 years. And to make it clear that Central District Health has no regulatory authority to make us pump our septic systems every 5 years, even though there's that thought out there. So, thank you.
The only regulatory thought is the thought of your drain field failing because of not
Your water table, not this year.
pumping it.
Yeah, not this year.
Our water table's high in Valley County. It's decent stuff.
Very good. Any other further discussion? All right, then all in favor of adopting the motion, signify by saying aye.
I,
Any opposed? Very good, motion carries. So we have new fee schedule. All right, next up is our director's report for us.
Okay, I just have two quick items. One is Laurel does an amazing job presenting the budget to actual and cash balances and where we're at on our projects is just, you know, I talked about this in the past, but just heads up for the August meeting, whatever cash we have to carry over, likely whoever the new director is will be presenting a request to use approximately 250,000. We'll have to, put it out for bid is for the roof for this building. So pretty much we've put a lot of investments into our buildings over the last couple of years, and that's winding down new roofs for like the McCall office. We've done a lot of work on the Mountain Home office, internal, external, and this, besides the bathrooms, this is the biggest one that we see coming up, and it's a huge footprint, so high cost. So that'll be likely coming in August as a request for that one, utilizing carryover as a one-time cost. The second thing is the attorney that we have used. We don't have access to the AG's office. We're not a state agency, so we've always used a private attorney. And pretty much since I've been here, that's been, we've used Mike Kane, and he is retiring at the end of this calendar year. So we're in the process of working, we, as in Nikki Zog, the Director of Public Health District 3, she and her team have also used Mike Kane for all those years, working with him to identify a new attorney to take over, obviously before Mike retires, and I would like to have that person in place before I retire. So Mike's having conversations. We're trying to find somebody with government experience, working with local government or city government or county government. So he has a few names and people he knows that he's reaching out to. My expectation is within a month, we'll know who we're going to work with, and then as we have issues come up, we'll probably start making that transition with Mike and them, so they're prepared to take over fully at the end of the calendar year. We have some really good prospects, people who have that experience, and so, yeah, that's all I have.
Very good. Well, thank you. Well, then next, I think we are going to have an executive session to discuss things.
The next motion has to have that, yeah, so just reading it specifically off the agenda, exactly how it's written. Enter executive session under.
I would move that we enter executive session per Idaho Code 74-2061A to consider hiring a public officer, employee, staff member, or individual agent wherein the respective qualities of the individuals are to be evaluated in order to fill a particular vacancy or need.
Any discussion? All in favor?
Roll call.
Oh, sorry.
Caldwell, I.
Roger, side.
Not I.
No, tonight.
Birch, aye.
Executive session 11:45.
All right.
And then,
All right, we're out of executive session. There is no action item that came as a result of our time in the executive session. So we are going to move on to the open discussion time. And as far as I'm concerned, the only thing I just want to bring up quick is it looks like it's official. The President's Physical Fitness Award is back. And Trump revives the annual fitness test that was canceled at the beginning of the Obama administration. So now we're going to start emphasizing fitness and competition in schools again. I think, in my opinion, that's a good thing. I think that's enough for today.
You, rest of the word, that's something.
That,
Jeez.
That was a look at that. I love it.
oh, that thing.
Oh, my gosh. Oh, my gosh. Woo. Where's the wheelbarrow?
We have one.
Oh, my goodness. Oh, this is cool. This is really cool, guys.
I know from Elmore County, we truly appreciate all the.
Yeah. So,
So much.
so since we're still on air, this is your last meeting, right? Official meeting,
Yeah.
other than, so Betty Ann has been on the board for quite a few years. And I think I'll let Russ say a piece, and yeah, I think he has a little bit more history and
Yeah.
time frame.
For sure. So Betty Ann started on the board in 2003. And then I came on board as director in 2005. So we've worked together for over 20 years. And Betty Ann has been in various leadership roles with the CDH board. She was the chair during good times and not so good times, and did a fabulous job, of course. And she was also had the honor of being the trustee during the conversations that occurred about our funding formula for the state general fund, and those were intense, difficult, challenging. It ended up leading into a report from the Office of Performance Evaluations because of the things that Betty Ann was bringing up. It was done in a way respectfully, but we needed an independent body to do the evaluation. And then after that report was done, 2 years later, the House Bill 316 was passed. And that, in my opinion, was from a relationship perspective with all the health districts, that's the best piece of legislation.
Absolutely.
And certainly in my time that was ever passed by our legislature, because it took that debate off the table.
Yeah.
And allowed us to work toward more important things like public health and not.
Every year it was a 6-1 vote. Guess who was the one?
Yeah.
Yeah.
Yeah. Yeah, so appreciated all your support and all these years, and you're always involved and going to the NALBO conferences and bringing great ideas back to CDH and to our state. And yeah, it's been a good run. So thank you for all you did and all that you did for me.
Well, thank you. Thank you. You know, Jane and you have been around for, well, Jane's been on longer than I have. And of course, you just heard Russ, and it's just an honor to be able to do something positive for our communities. And it wasn't always easy. No, it wasn't always easy, but I think we've had a good impact. And one thing I would highly encourage the new board members to do is to consider state and national education seminars. Those were amazing. because this thing of public health is beyond complex. So thank you, everybody. Been an honor. Is this a back brace or a cane or what? Hey, I'm getting a new horse, so.
Yeah, all right. No saddle in there, but,
Yeah. Oh, I only have one special.
okay.
And you guys will laugh at this, especially Caitlin. This saddle is so special. The only time it sees sunlight or anything is when it's on a horse. Now, here's the real funny thing. I take it off my horse and I bring it in my living room.
That's special.
I have a Quake and Asp stand from our mountain property that it goes on in the living room.
Nice.
Now we all want to see a picture.
But
Now we all want to see a picture.
But thank you so much. It's been a pleasure and a privilege.
This happy retirement's all around.
Yeah.
Part way around.
Yeah, Russ and I won't be meeting here. We'll be meeting on the desert or on top of a mountain.
Facing a turkey.
No, I won't be chasing the turkey.
Well, thank you for finishing that. Being on top of it again.
Run it down Emerald.
Here's your back brace.
Right, right. Well, I'm just looking here. Yeah.
All right,
Beautiful,
very good.
Beautiful.
In my 2 years, it's been a pleasure. Thank you for your guidance and support. With that, anybody else?
Camaraderie and direction. Well, thank you. I tend to be a bit outspoken, but I believe in that's the way it is. Need it.
All right, well, very,
No sugarcoating.
well, very good then. We'll adjourn the meeting.
That's one thing. That's planning to stay on, right?
You have to ask her.